so much for the invitation. It's a big pleasure to be here. My name is Katherin Thormann. I'm a nurse practitioner at the Department of Dermatology at the Inselspital in Bern, in Switzerland. And this talk is about the role of nurses in therapeutic patient education in atopic dermatitis. So I'm pretty sure everybody in this room knows that different healthcare professionals can be involved in TPE in atopic dermatitis. You can see here some examples. Of course, dermatologists can be involved, or psychologists, or allergists, or even dietitians, or we have just heard the ones which are in the pharmacies, or nurses, you can see here at the bottom of the list. So, however, we do not know a lot about the current situation of nurses. That's why we are very pleased that Hélène Aubert and her colleagues have just published an international survey, which had the aim to examine the role of nurses in the management of patients with an atopic dermatitis. 85 healthcare professionals from 20 different countries answered the questionnaire, and you can see here 3 results. 75% reported interprofessional co-working between nurses and dermatologists. It seems to be very common. Then over 80% of dermatologists are actually interested to involve nurses. However, there are some barriers, mainly economic ones. We know from the literature that the nurse seems to have an important role. For example, to improve self-management, or to increase the use of topical therapy, not only the basic therapy, but also to use topical corticosteroids, to achieve high patient satisfaction. Actually, we were wondering why this is the case, and we could find an article which pointed out that nurses have more time to spend during the TPE session compared to physicians. And this seems to be an important point why patient satisfaction is high. Or to get a long-term relationship. This can be achieved when follow-up education sessions can be performed. However, some studies could not determine a significant effect on DLQI and/or disease severity scores, and there is a lack of knowledge if nurses have an effect in interprofessional TPE sessions. So we couldn't find an article or research which actually determined or assessed the effect of nurses in interprofessional TPE sessions. However, daily practice teaches us that nurses play a crucial role in the management and in supporting self-management. You have already heard that there are two TPE modalities available, such as the individual approach. One session lasts between 30 to 60 minutes. It can be repeated, I think that's a big advantage, or this group approach, which is normally set up as lectures or workshops. They consist of different sessions lasting approximately 2 to 3 hours each, and it's very often interprofessional. And most importantly, nurses can be involved in both approaches. However, if you want to include nurses in your TPE program, there's very often the discussion or the question, which qualification status must a nurse have? And it's quite difficult to have an overview about our qualification status because we have a big range and it varies between countries. So that's why I brought you this slide. It gives you an overview how it is organized in our country. And as I said, it's probably different in your country. So you can see here at the left-hand side, we can do an apprenticeship. These nurses are called normally nurse assistants. Or we can do a diploma in advanced studies. Then we call them registered nurses. And that's probably the role which we are all thinking of when we think about nurses or when we talk about nurses. We can even do a bachelor degree or a master's degree at the University of Applied Sciences or at university, and we can also do a doctoral degree. So you can see the qualification status, the range is quite big. And as I've already said, it varies between countries. However, we're pretty sure that TPE can be done by all nurses. But they must be trained in patient education. Normally, we do have this concept in our country during our studies. We are very well trained in patient education. However, we do have just 2 or 3 hours dermatology. So we need to develop a lot of knowledge and skills during our practical work. And we are very often trained by dermatologists. However, there are some train-the-train courses available in our country to learn how to perform TPE in atopic dermatitis. After this course, nurses get a certificate which actually confirms or proves that the nurse acquired the basic knowledge of TPE. Or there's even this concept of advanced practice nurses. It's a concept which is well established in some countries, for example, the United States or Canada. In some countries, there are no advanced practice nurses. In our country, an advanced practice nurse must have at least a master's degree, and they ensure evidence-based care, supportive care, continuous care, and they can even take over tasks which are usually done by physicians only. And advanced practice nurses can be involved as well in TPE. What kind of specific tasks can a nurse perform? Well, they can speak about the theoretical background, such as the basic therapy, or they can talk about the clothing or textiles, each scratch cycle, or practical demonstration, and I think here lies a big strength. Nurses can show how to apply the different creams and ointments. They can show how to apply topical corticosteroids by introducing the fingertip units, for example, or they can show how to do wet wrap bandages, zinc paste bandages, or introduce distraction techniques against scratching. Other tasks, the nurse can have as well a very supportive role. She or he can actually talk or discuss with the patient together how they can transfer the treatment recommendation into their daily life. They can as well do follow-up education, or collaboration with community nurse is another task. Treatment action plan, we have already heard a lot about treatment action plans. Well, in our clinic, treatment action plans are filled out by nurses, of course, based on the recommendations from the physician. Further contents, if you have an advanced practice nurse in your clinic, then she or he can even talk about the pathogenesis, skin barrier function, inflammation, trigger factors, how to eliminate trigger factors, nutrition. And we have already heard a lot about all these new drugs, and we should probably think about new contents as well. So instruction on injection techniques would be an example, or recognition of adverse effects, and I'm pretty sure there are even more contents which I didn't think of. However, if you want to involve nurses, my experience is it's quite important that they have material which support them. We do have this kind of folders, which you can see here at the left-hand side. In these folders, the theoretical background is included, and it helps to guide the nurse through a TPE session. Or we have a lot of different creams and ointments just to show how to apply the cream, the ointment. We have a lot of different leaflets and brochures, etc. Or we have this kind of standards. If the nurse wants to deepen the knowledge, or if they have questions, they can quickly look up this kind of standards. We have standards about the topical corticosteroids with wrap bandages or itch management, etc. And all these standards are based on latest research and guidelines. I think I do not have to say anything about this slide. We have already heard a lot about the treatment action plan. And just to remind you, a treatment action plan can also be filled out by nurses. So if you are interested to set up a program which involves nurses, we tried to set up this algorithm with important points which you should probably think of. You can see here at the right-hand side, it has a deeper focus on nurses. So you should probably think of the role. Should it be a registered nurse or should it be an advanced practice nurse? What kind of competences should the nurse have if you want to involve one? And what kind of requirements are needed? So as summary, involving nurses in TPE provides substantial benefit. TPE can be done by all nurses. Different tasks and topics of TPE can be provided by nurses, but I'm pretty sure different materials and supportive tools are needed. Thank you so much.